Good evening and welcome to our COVID-19 update program. I'm Neota Igwe. Here are the highlights at this hour. More schools reopen across Nigerian states as governments insist all safety protocols must be followed. Bauchi governor orders the production and delivery of locally produced automated machines across schools in Bauchi, and global coronavirus deaths nearing 1 billion. Private and public primary schools and secondary schools have resumed across 17 local government areas of Enugu State after 6 months of compulsory lockdown occasioned by the coronavirus. The leadership of both public and private schools in the state, the resumption is up to enable them make up for the time schools were not in session. According to the Commissioner for Education, Professor Uche Eze, the government has released a adjusted school calendar which will hopefully normalize the initial school calendars after 9 months.
Their joy knows no bounds as pupils and students arrive to their various schools across the 17 local government areas in Enugu State for the first time since March 2020. They come into their school compound one after the other with their face shields and masks on. Some even came in the company of their parents. They proceed to their classrooms after their temperature is checked at the gate and hands are washed. In the classrooms, chairs are arranged observing the physical distancing protocols as students and teachers exchange pleasantries.
I'm glad coming back to school for after 4 months now because of the pandemic. And a lot of things are happening in the school. Our teachers are coming to school to teach us and we are enjoying the teachings.
They normally come late, but the speed and the rush I met them this morning coming inside as early as that time was very, very impressive. So they're happy about coming back.
Okay.
Also in private schools across the state, modalities have been worked out with sick bays and medical officers in place to take on any emergency that could arise within the school premises.
If you ask me, I will tell you that we are very prepared. If you move around Enugu State, especially for private school, which I'm in charge, I'll tell you that we are really, really ready. And we have done so many things. If you looked at my gate, normally when you come to school, you write down your name and write that. But we had removed that, introducing what we call tag, attendance tag. As you are dropping your child, you are taking a tag.
The Commissioner for Education in the state says government has released an adjusted school calendar that will hopefully reset the school program after 9 months.
It will take 9 months to cover the lost ground for third term. Early December, we are going to start our first term, and we have planned the academic calendar in such a way that by 14th August 2021, we will end the 2020-2021 academic session. If we are able to achieve that, we normalize the academic calendar and things will flow the way it has been.
Meanwhile, more hand-washing equipment has been acquired by the government to be distributed across the schools. The question, however, is whether or not this adhering to guidelines will be sustained across the state over time.
From Enugu, we head to Akwa Ibom State, where schools have reopened. The students and the teachers have expressed their excitement to be back in school. This report captures the moods of these students and teachers on the first day of resumption after the long holiday.
As far as I'm concerned, I can say we are 100% ready for the resumption of students coming back to school and all that, following the COVID-19, directives on keeping the kids safe and all that. We had training for the teachers in how to handle the students when they come back to school. We made sure we put a lot of things in place like outlets for washing of our hands, sanitizers and all that.
We have that exciting feeling having our students back to school. Yes, some of them were actually so happy to see the teachers coming in, and we, the teachers, are also happy having them back.
I feel very, very excited to come back to school after a very, very long time. I think I've missed so much, and I think that with the way the school is going, I think we're going to catch up with time. And I'm very, very happy to be at school.
And southwest Nigeria, Ekiti to be precise, classes are resuming in phases and teachers and students are adjusting to the new normal. As observed across the state, students come to classes with their face masks and they have the prescribed temperature checks and sanitizing of hands done. Few students still follow the rules, but either by not having or using their face mask. The teachers and heads of schools say they have been hands-on to enforce the protocols, and they believe the pandemic has further heightened the use of ICT. But the students eagerly hope for a return to the old ways where they can interrelate without borders.
We have tried close to 90%, let's say 90%, to make sure that they distance themselves, and we make sure on timetable they wash their hands minimum of 4 times in a day while they are in the school compound, and we sanitize them. And we make sure all of them use face masks.
We pray that this COVID-19 should be over soon, because we do not used to be as we are in the class before. Before we used to play with each other, we used to stay free in class, but now we go to class with our nose covers and we sit far away from each other.
Well, the decision reached at the end of a stakeholders meeting at the state's Ministry of Education in Minna, Niger State, is coming 6 months after schools in the state were closed down due to the outbreak of COVID-19. Based on that directive, all teachers are to return to their respective schools from Tuesday, the 29th of September, to commence preparations for reopening. The Commissioner for Education in Niger State, Hannatu Saliu, says various consultations were made based on the reports of the committees on school reopening set up by the state government to arrive at that decision. And in Yobe State, the Malala Fund, in collaboration with Connected Development Code, has applauded the role played by the Universal Basic Education Board in accessing counterpart funding to ensure that girls get timely and quality education in the country. This applaud was given during an interface with stakeholders in the education sector in Yola, the Adamawa State capital. According to the organizers, the Malala Fund Girl Child Education Campaign is aimed at drumming support for an increased girl child enrollment in secondary schools and their completion. The fund therefore appeals to the Adamawa State government to increase its efforts at the enrollment of the girl child into secondary schools.
These are some physically challenged Yobe residents displaced by Boko Haram insurgents and affected by the COVID-19 pandemic. The situation is same with some thousands in the northeastern parts of Nigeria. These relief materials are from the federal government to cushion the effects of both the Boko Haram conflict and the novel coronavirus pandemic.
We are targeting at least 1,000 households. About 1,000 households. We're able to reach 200 households within Damaturu, and we're going to look at other vulnerable LGAs that have been most affected by insurgency and have a large number of displaced persons.
To the Yobe State government, keying into the federal government's program will reduce the burden on its shoulders, having been under the Boko Haram crisis for about 11 years.
Our distribution in Yobe State is to reach beneficiaries directly and hand-to-hand. And this is evident by our today's flag up. And the items distributed cut across some locations, including medical consumables to primary healthcare centers, dry season farming implements in some locations, food and non-food items, dignity kit to pregnant mothers, and what. So we are grateful, and we hope this collaboration with the state will continue to reach more vulnerable population, and we assure the Commission that the beneficiaries will use the items for the intended purpose.
The beneficiaries, who are mostly physically challenged persons and vulnerable women, applaud the federal government for the social inclusion of their members in this gesture.
What we have seen here today, it will go a long way. Why? Because these are the people that they were displaced. More especially if you look at Gujiba local government and Gulali. They are the area they are worst hit by Boko Haram crisis.
No doubt supports of this kind by either government or individuals will reduce the number of physically challenged persons roaming the street for alms.
Managing the spread and prevention of the coronavirus pandemic has renewed the call for the payment of a new hazard allowance to all health workers. This is one of the many demands at the end of the 40th Annual General Meeting and Scientific Conference of the Nigerian Association of Resident Doctors at the Delta State Teaching Hospital in Ogara. The three-day conference deliberated on several issues, including the COVID-19 pandemic in the country's health sector, leading to several industrial actions even during the peak of the health crisis. The doctors also urged the federal government to ensure the full implementation of the Medical Residency Training Act of 2017 for them.
The AGM noted that the state and government have put their members in a state of tertiary health institutions, particularly APSUTs, IMSUTs, and LASUTs. They can observe irregular payment of salaries, shortfalls, and arrears of part salaries dating from 2014 of our members across the country. The AGM noted failure of some chief medical directors to implement the Resident Training Act of 2017. The AGM noted the commitment of federal government to have a collective bargaining agreement with the relevant stakeholders to determine a revised hazard allowance for health workers. The AGM demands that the state government to ensure full implementation of the Medical Residency Act of 2017 and ensure proper funding.
And now to look at the resumption of schools and the demands of the resident doctors, we're being joined by Dr. Ajoke Adewale, a public health physician. Thank you for joining us, Dr. Adewale.
Thank you for having me.
You sound like and look like you're very excited that schools have finally resumed.
Well, yes, it has to. I'm not very excited, but I'm excited because at some point in time, we have to start returning to how things used to be. Our children have been on break for a very long time. And as much as we are trying to make sure that we are mitigating against the consequences of COVID-19, the COVID-19 pandemic, we also have to make sure that these children are academically and emotionally balanced. So it's good. It's a good step, but it has to be very well guided.
You know, you said we have to start taking steps to return to how things used to be. Is there a chance we could ever return to that in the next 6 months, to how things used to be?
Not likely. When I mean how things used to be, I mean incorporating the new normal, wearing face masks, the new normal with the activities that used to sustain our academic and economic activities. I mean, our economic part of our lives. We can't just keep everything continuously on standstill because of the pandemic. That is why experts are on ground to make sure that we are guidedly doing, making sure that the new normal is in resonance with our own self-development and sustenance of our economic and academic activities.
Now, let's look at that thing about being guided towards a return to normalcy in life generally. Let's look at some of the schools that have resumed. We heard our reporters report on the situation in Enugu, Akwa Ibom, and several other states. While some are phasing it, some have gone all out, and some are resuming from the 5th, from October. In all of that, how do you think the children, yes, they're excited to be back in school, but then some of them are still not following the protocol? What can be done?
Yes, so we need to train and retrain our teachers, our children, our parents. There has to be continuous health awareness and enlightenment. I'm aware that there is COVID-19 prevention fatigue. I mean, everybody is becoming lax in the way they prevent they prevent this disease. People are no longer wearing masks. They are not washing their hands as much as they used to. And that is why there is a need to make sure that people are trained consistently. We do not have to relax on our surveillance activities. I mean, surveillance involves screening the children, the parents, the teachers. It involves keeping ourselves widely alert to the possibility of having an epidemic or a surge, even as children are coming together. So these are calculated risks that we have to take. People need to follow the protocols, because if there's any surge of this COVID-19 again, especially in our school, we may need to shut down school system entirely. At the end of the day, the health and the lives of these children matter. And if we are not able to successfully make this work, we may need to revert to status quo. And this is the reason why parents, teachers, and children, so children at every developmental age they are, can be informed. They can be given graded information that they would appreciate. So, and I can see that this is already evident in many children. They can tell you about COVID-19. Some will not touch you. They would rather do the elbow shake. So it shows that our children are being informed, and these are the kind of things we need to push for.
But when you're dealing with children, as you said, they should be given graded information. Now, when we're dealing with children, there's that likelihood that they are easily excitable, and so they could easily let down their guard. How much of alertness should the adults around them have?
A lot. And that is why I said that, in public health, we take calculated risks. And that's why I said this is a joint, this will come with positive outcomes only with the joint commitment and effort of the parents, the teachers, and even the children. So children are naturally very playful. They want to explore. They want to touch one another. And, the same way they learn the 1, 2, 3, and they learn who's the president of Nigeria and the rest, we can consistently give them information on COVID-19 such that they correct you adults. I mean, it's not unachievable. And that is why most areas are doing graded phased learning. So you see some schools saying only primary school students can attend. And in some states, you're hearing, 3 days go to school. The other days do your virtual, using so many apps, Class Dojo, and even the Lagos State has provided learning apps. So what we are doing is keeping our surveillance, hopefully what we are doing is keeping our surveillance ears open and watching these kids and educating them. It's a very tough task. It's very, very tough, but it is doable. I mean, same way these kids learn everything, they can learn about COVID-19 and they can also assist us to keep safe.
Now, while we're looking at this, and we're glad, honestly, some of us are glad that our children are getting back to school, because they were actually a burden to some parents who could yes, they love the bonding with the children, but can they just go back to school so that they can move on to other things? But while we're all looking towards that, what happens to the loss of that sense of caution now that it looks as if everything is normalizing?
I mean, this is something we should, just the same way during Ebola fatigue, people lost caution during the Ebola, during Lassa. After a while, there was so much awareness, and after a while, people went back to doing things that they were not. People stopped washing their hands after Ebola, after the hype about Ebola reduced. That's why we need to train and retrain. That's why we need to keep on talking about it. It's just in the natural human behavior. Even in more developed climes, this is already happening. People are letting down caution and going on so many protests and large gatherings. So what we need to do, I mean, for instance, our children were taught during the holidays, in quotes, they were made to do video presentations. I mean, my children were made to do video presentations on COVID-19, and I assume this was the norm everywhere. So children are beginning to learn about COVID-19 the way they are learning about other forms of health education. So we just have to do our part as parents, let the teachers do their part, and then the government has to play a role. So continuous inspection. If, unfortunately, the way human beings are, if there's no enforcement, if there are no punitive measures, then people won't stick. So the government needs to send out inspectors from time to time, and without warning, so that schools will learn that they need to be on top of their guard if they do not want to be closed down.
Okay, Dr. Adewale, we'll take a moment and then we'll come back to continue this conversation. We'll also look at how the healthcare providers are also taking on this new normal and how they're also preparing for the possibility of a surge. We'll be back in a moment. Don't go away. For staying with us, we still have Dr. Ajoke Adewale, a public health physician, having a conversation with us as regards the return to school and what the health practitioners and providers are also doing and preparing to do in the course of managing the pandemic. Thank you, Dr. Adewale.
Thank you.
So we're talking about the children and their return to school. one of the cases that our reporters pointed out was the fact that some students were still not used to, or didn't have their masks, or were not wearing them, those that had them. You said earlier about training and retraining the teachers. How often should that training be taking place?
So definitely, this is something that the school administrators will do informally in form of supportive supervision on a daily basis. So you should have the school administrators go to each class periodically during the day, every work day, and you can have like once a week meetings. I mean, these are just suggestions depending on the population and the peculiarities of the schools involved. Bear it in mind, we have private schools and we have public schools, and these have two different kind of population settings and infrastructure. Hopefully, both parties are doing what they need to do. So these trainings can be conducted weekly. It can be supervised weekly by also the government. The supportive supervision is something that needs to go on every single day. So it needs to be supportive. It needs to be technical. So they walk into the children's school, they see into the children's classes, and they see a child not wearing the face mask properly. And then you call the child out and explain. Use the child to explain to others in a very nice and friendly way how things should be. So this requires a lot of commitment, I agree. But is it doable? Yes.
You say the teacher should be doing this, and yes, the government should provide supportive supervision. The role of the parent here and the family members and the community in general also would likely come into play. So how would you explain to certain communities where you go to, you find out out of 10, maybe 2 out of 10 are using the mask. So how would you explain to those other 8 whose children see their parents not using the mask in public, how they should go about wearing the mask without examples?
Now, in fact, you've pointed out a very weak link. We both know that when we go out into a lot of communities right now, the only reason people wear face masks is because they want to be admitted into a mall or into an eatery. Otherwise, they wouldn't be on their face mask. Many people are like that right now. And so there's a lax in the preventive measures that people are taking. So that point you mentioned seems to me the biggest of the weak links, or the weakest of the links, so to say, because most children will likely do what they see you doing. And as a parent or primary caregiver, you spend the most time with your child. If you are telling your child says, "Mommy, let's wash our hands," and you say, "Oh no, don't worry, we'll do that later," or the child is seeing you come into the house and you're not washing your hands or going out without the face mask, the child is likely to just see this as a school issue. Oh, okay, maybe if the teachers are doing a good job, that is. And so the parents play a very crucial role. As much as we want to breathe down hard on the schools and the school authorities and the education sector, it starts from the home. So parents owe their children a duty. And when you think about it, when their health is compromised, it's a lot of burden to the parents. So I think it's something that parents need to invest a lot of time, effort, and attention to. Once you're in the house, I mean, even babies know. They bring out their hands and they ask for sanitizers. And that should be the culture. So, I mean, this is something that parents need to sit up. At least for the sake of your parents, if you're not looking at your own health, I mean, at least for the sake of your children, I mean. If you are not bothered about your health or you think that you're super immune, just for the sake of the children, start practicing what you want your children to do in school.
Just before we let you go, let's look at that matter of the National Association of Registered Doctors and the emoluments they're talking about, hazard allowances being paid, some not being paid. And then they talk about some states that were owing some of their colleagues' salaries, some even up to like 1 or 2 years back. What should that be coming up now in the face of this pandemic?
Well, I would like to sympathize with the government, because a lot of budget has skewed in the wake of this pandemic, and it has taken longer than many foresaw. I would like to say that the resident doctors have a very valid concern. The hazard allowance is the allowance that is paid to them in case of any eventuality. On a daily basis, doctors risk their lives, and resident doctors especially are in teaching hospitals where they see the most of the patients. They're in federal and teaching hospitals. So, and you know, COVID-19 is not written on the face. So they have daily clients that come for even things as little as different as family planning, and for other things who end up transmitting COVID-19. Doctors have families too. So I would like to enjoin the government and the NARD executives to see eye to eye, to sit down and have an action plan. It's unfortunate that a lot of trust has been lost in between this struggle, but it is time for the government to at least pay more attention. This is COVID-19 now. I mean, a lot of my colleagues had COVID-19 in the course of this pandemic. A few of them died in the course of discharging their duties. So are we saying they deserve to die? Fine, this happens to the general population, but health workers are not doctors, are generally more at risk. And so we need to pay urgent and immediate attention to this. Let the doctors feel prioritized, because right now, they are the greatest exports that this country is offering to other countries.
Thank you very much. Dr. Ajoke Adeole is a public health physician. Thank you for sharing this evening with us.
It's my pleasure.
And staying in line with that conversation, the Bayelsa State Governor, Doye Diri, has directed that all schools from primary to tertiary institutions resume on Monday, the 5th of October 2020 for the third term 2019-2020 academic session. A directive by the governor came after a closed-door meeting on Monday with the Committee on Safe School Reopening in Yenagoa, Bayelsa State's capital. Briefing newsmen on the outcome of the meeting with the governor, the Commissioner for Health, Dr. Pabara Igwele, and his education counterpart, Mr. Gentle Ebela, warned that the private schools that don't meet up to standard and adherence to the COVID-19 protocol will be shut down.
Talking about those that are running our schools, the headmasters, teachers, principals and teachers, and the vice chancellors, rectors, and the provosts of colleges, of schools in the tertiary level, as by this information expected to resume or to open their schools for normal class activities. Before this decision was taken, you will agree with us that the terminal classes in the primary and the secondary level were in session, preparing for the exams. As we speak, those in JS3 are in school, and we've been observing them. They've been complying with the COVID-19 protocols, and those in primary 6 also have been in school, learning and equally observing the COVID-19 protocols. And so far, so good. We feel that we are good to go. And that informed the decision of government that all schools should resume on the 5th.
By the special grace of God, the curve has flattened completely in Bayelsa State here. And so this made us to resolve and to advise the committee. And since we don't have that significant new active cases in Bayelsa State, and then we are safe to reopen schools, and we have the molecular laboratory that will be able to run tests. We have our people on the field trying to get more samples in the various communities and the environments of Yenagoa local government. And so by the special grace of God, we are hoping that we will not have any new case for a repeat spike in the COVID-19 here in Bayelsa State.
Now, let's stay on in Bayelsa State, where the government is seeking to ensure that testing continues. So they started out what they call institutional testing across the state. Our correspondent, Deborah Timmy-Woods, will tell us a little bit more on that. Deborah.
The number of active cases for the coronavirus in Bayelsa State as of today is 6. But the COVID-19 task force in the state says they don't want to be fooled by the low numbers, hence they have begun community testing. We spoke with the Director of Public Health, and he explains to us the methods they are embarking on to ensure that most Bayelsans are tested for the coronavirus.
What we'll do is to enter the community appropriately, and there are ways of entering communities, When we meet with the community stakeholders and get them to know the reason why we've come to those communities and to talk to members of that community, we'll move from household to household, just to speak with them and ask them generally about if they've heard about COVID, if there's anybody in this household who has had a fever, a cough, a sore throat, respiratory distress in the past 1 week or thereabout? Do you understand? We want to ask all of those questions. So if there's somebody that said yes, so there was somebody who had those symptoms you were referring to, then we'll talk nicely to them, see if we collect samples, and collect samples from all of those people around that person that could have a contact. That's what we'll do. And the reception has been okay. Of course, we won't get a 100% reception, but in some cases it's been perfect, and people are actually responding perfectly to what we're doing.
398 persons have been confirmed for coronavirus in Bayelsa State. Out of that, 371 persons have already been discharged. Like I said earlier, there are 6 active cases and the state has recorded 21 deaths. From Yenagua, Dobra, Timiwood, for COVID-19 updates.
And the Nigeria Center for Disease Control announced 126 new confirmed cases and 2 deaths in the country. The cases are reported from 11 states and the FCT. The FCT had 30, Lagos 24, Rivers State had 23, Ogun 13, Katsina 9, Plateau 9, Ondo 6, Kaduna 4, Kwara 4, Imo State 2, Bauchi 1, and Edo State 1. In Kaduna State, the 4 samples returned positive out of 43 analyzed. The new cases are 1 each from Jikun and Sabongeri and 2 from Kaduna South. Till date, 58,324 cases have been confirmed in the country, 49,794 cases have been discharged, and 1,108 deaths have been recorded in 36 states and the Federal Capital Territory. Now, some youth from the National Center for Petroleum Research and Development, Abubakar Tafawa Balewa University, Bauchi, have invented an automated hand sanitizing machine which performs multiple functions. A locally made sensor machine accommodates soap, water, a dryer, a dustbin, voice message, and it's able to read body temperature. The team presented the invention to the Bauchi State Governor Bala Mohammed, and it directed them to produce in large quantities for onward distribution to schools.
Since it recorded its first positive case with manpower shortage across its workforce, the state government announced plans to make deductions from workers' salaries to fund the fight against coronavirus. Bauchi State, with a population estimated to be close to 7.3 million, has challenges in testing in some members of its community. Solace, however, seems to have come with the development of this engineering solution by some youth from the National Center for Petroleum Research and Development at the Abubakar Tafawa Balewa University in Bauchi. This solar innovation multifunction automatic device has in it a soap dispenser, tap water, a hot dryer, and a thermometer.
This machine, as you can see, we have incorporated hand detecting sensor that will detect your hand, dispense the soap, read your body temperature, as well as dispensing the water automatically without making any contact. And then after you finish the hand washing routine, you have the tissue by the side, which you rinse your hand and then dispose in our waste bin.
Delighted over this development, the state governor, Bala Mohammed, gave a directive for the production and distribution of the machine across schools in the state.
You have really imbibed in this invention and this innovation. You have provided an engineering solution, and it is very cost-effective at the cost of 150,000 naira. Definitely, I will direct the deputy governor, who is the chairman of the COVID-19, to discuss with you with a view to producing this machine massively for use in our schools.
Not minding the costs of this locally produced COVID-19 compliance machine, one significant point is that the device will run sole on solar energy.
Interesting times and wonderful inventions there. But let's go to South Africa, where the recovery rate has gone up to 90% as the numbers cross the 600 mark at the weekend. With over 4 million tests done so far, the number of confirmed cases is nearly 672 million. Government is appealing to the people to continue to adhere to health safety regulations as the country gets set to open its borders to international visitors on the 1st of October. For now, the list of countries that would be allowed or barred is yet to be released, and the affected sectors eagerly await the announcement from government. Here's Betty Dibia, who is in Johannesburg, South Africa, to tell us more. Betty Dibia is a South Africa Bureau Chief. Thank you for joining us, Betty.
Thank you, Nelta.
Let's start with what's going on here in Nigeria, for instance, where schools are reopening across different states, and the students and children are really excited to be going back to school with their teachers. What's the situation like in South Africa?
Well, we opened up schools much earlier here, although for the higher institutions like the universities, it's just 2/3 that are already in school. We expected the higher education minister to speak to the nation today regarding the last third of the students, most of them probably international students who are stuck outside the country, on when they will be resuming. But basic education, as they call it here, primary and secondary, they've had a staggered return to school. Going back 1 or 2 months, about 2 months, I know that the private schools began return to school 1st of September, but the public schools and the semi-public schools, what they call the Model C schools, have been returning to school, and the lower grades, grade 3 down, have alternate days they come to school, probably 2 days or 3 days in a week, but from grade 4 to grade 7, they go to school every day. And the latest news in that sector is that the teachers who were previously allowed to work from home because of comorbidities have now been instructed by the Basic Education Minister, Angie Motshekga, to return to school. And she will be visiting some of the schools, to see what's going on tomorrow. We expect that to go and visit some of the schools here in Johannesburg tomorrow to see or just show some support to some of the schools and the teachers who are just returning to school. But it's hectic for some pupils who are struggling to cope because a lot is being done. Remember, again, grade 12s are going to university. Their final exams have been moved to November, and they're trying to help them calm down to cope with the situation, learning in the COVID times.
Indeed. I was going to ask you a question as regards the government still appealing to some people to abide by the safety protocol. And how's that working out? Is it that they're throwing caution to the wind because everything else is being relaxed?
Well, we're in level 1 lockdown, and some people are still partying up a storm, and they're appealing to them to just be safety conscious. There are numbers that have been allowed, but as people often do, they exploit the loopholes in the regulations. Like outdoor events, you can have as many as 500 people. Indoors, you can't have more than 250. And then government says, wherever you're in holding an event, it shouldn't be more than 50% capacity. That could mean anything. So people are, and then we're seeing pictures of people not wearing masks. And the WHO has said you have to put on your mask, wash your hands, and maintain social distancing. But people are flouting that, and they're appealing to them for their own safety to keep to it.
That matter of wearing the mask appears to be spread across the world. A lot of people refusing to wear their mask anymore, especially maybe because they feel that everything's coming back to normal. But let's look at how everything will work out, considering the fact that South Africa is preparing to open its borders. Nigeria opened her borders, hardly to a certain number of countries not even. For the case of South Africa, no one knows which countries are going to be allowed in. So how's that working out?
No one knows. No one knows, so everyone is trying to prepare, and the worry for those, as I said, affected sectors like the tourism sector, not just tourism for play, tourism, medical tourism, and all that. You have some particular countries who are high spenders who come in, and some of these countries still have high numbers. So they maybe that's why it's taking the government a bit longer to let us know who and who will be allowed. But no one has an idea right now. And another side is the issue of the aviation sector, where the SAA, South African Airways, is still battling its demons. So we don't know how South Africa will also benefit. But I know if the aviation sector is opened up, for example, to particular countries, other airlines will be allowed in. Outbound, we're still trying to see how South Africa will benefit, but the worry is not opening up without caution so that you don't bring in numbers again, higher numbers. As the numbers are going down now, hopefully it will stay that way. But that's the worry. Excitement, but some caution as well, so that we don't go forward one step and 10 steps backwards.
The pandemic.
Cabinet is expected to meet.
Yeah, go ahead.
Yeah, go on. Cabinet is expected to meet tomorrow or next. So 1st of October is still Thursday. So maybe between tomorrow and Wednesday, we'll get to hear which countries. But the relevant departments, like the International Relations Department, Health Department, Home Affairs, they've been consulting. And for the weekly cabinet meeting, I'm sure that'll be top on the agenda, and we'll expect to hear that in a day or two.
I was going to ask you about the injection into the economy from the government in terms of bailout. Would they be looking, or has it happened, bailouts for the tourism sector, for the aviation sector? In fact, there was that news about the South African Airways having issues at one time. Is there a bailout being put out for them?
South Africa has been under, what do you call it? It's a business term, where the business rescue, it's been under business rescue since December. So the amount of money they've been, the people or the business rescue practitioners had asked for to help in restructuring the airline was 10 billion rand. Government has now committed to giving 10.3 or 10.5 billion rand. We haven't seen that yet, but they've given their word that they will be providing that, so that the issue of liquidation will not happen. They say, government says that the issue of liquidation is not on the cards, but they will provide that amount, being more or less the major shareholder in the airline, to find a way to salvage the situation.
Let's look at the human side of things. That thing about throwing caution to the wind. I do know that in some countries, or let me use Nigeria. In some states in Nigeria, if you're caught outside without a mask, you're fined as much as 300,000 naira in Cross River State, for instance. Now, in some of these states where this kind of measures, where some of those punitive measures are being even relaxed, do you think if that's brought into the system, would it help to bring back that sense of there's something out there and we still need to stay cautious?
With everything considered, government is just trying to balance the issue. You know how down and out the economy here is. People, as the president keeps saying, it's now time, while we try to balance, take care of this part, people need to take responsibility as well. You must understand that COVID hasn't gone. COVID is going to be here for some time to come. So it's just trying to strike that balance. I don't know if going back to harder lockdown or fining people will work in a country like this, but it's just the appeal. The police minister, everybody, the health minister, president, he writes to the nation every week, and these are part of the things that he talks about. But it's still getting people to see that the disease or the pandemic is still in place, to get them to understand, and that people are still dying. I know here in South Africa, numbers are going down. Maybe that's why people are getting more, getting brave, to do some of the things that they're doing. Even fatality figures has gone down from 3 digits to 2. Some days we see 29 in a country where we've been seeing 143 or 200 at some point. So I guess the appeal to people to get them, but there's monitoring. You have some of the law enforcement agents or officers going around and monitoring to enforce adherence to the regulations. We've seen some issues in some places, like the place where somebody was shot in Limpopo, or a gun went off where they were struggling with the army officers, trying to tell them, look, you need to put on your mask. And they were in a group as well. So a scuffle, they tried to disarm him. So we've seen such issues, but at the end of the day, people still need to take responsibility, for their own safety as well.
Thank you so much, Betty Diva. The watchword there is responsibility. Betty is our bureau chief in South Africa. Thank you so much for sharing this evening with us.
Thank you so much, Neota. Stay safe.
And do stay safe, you too. Almost 1 billion people have died from the coronavirus, with the US, Brazil, and India accounting for almost half the number. The virus is said to be surging in 21 US states, as the country's top infectious disease expert, Dr. Anthony Fauci, warns that the country is not in a good place. The number of coronavirus cases globally has surpassed 33 million. Meanwhile, new restrictions have come into place in parts of Paris, France, and Brussels, Belgium. Here's your global update.
In India, novel coronavirus cases have tipped beyond 6 million as the country nears the peak period for Hindu religious festivals. The Southeast Asian country added 1 million cases in 11 days and is only second to the United States in total number of infections. India has seen just over 82,000 new infections in the last 24 hours. Despite President Emmanuel Macron's decision to shut down bars and restaurants in France's second largest city, Marseille, some restaurants remain open today. The government order came last week after Marseille and its surroundings on the Mediterranean were put on maximum alert level as it's become the epicenter of the country's second wave of coronavirus infections. In Brussels, public transport workers have disrupted the network with a strike demanding employers take corona-proof actions for their employees. Many metro, bus and tram lines did not work as a result of the strike. Unions are also demanding an increase in allowance of pensions, unemployment and health. Finally, in Russia, the number of citizens getting a seasonal vaccination has significantly increased amid rising fears of a second wave of the coronavirus. Russia has been one of the countries at the forefront of finding a vaccine for the virus and has already begun delivering the first batch of its Sputnik V COVID-19 vaccine to Belarus for clinical trials.
And that's our package on the COVID-19 update program for tonight. You can take a closer look at some of the COVID-19 global numbers in real time. Check out our website, channelcv.com. You will also get more updates and better understanding of all you need to do to stay safe in this period. And of course, there are other stories in politics, business, and sport. To join us for a fresh package of the program tomorrow at noon, 6 p.m. and 9 p.m. Thank you very much for watching. I'm Neota. Good night.